Executive Media. Focus, innovate, succeed.
Ikop bakube babifanani.
Olikwenda bifanani birungi. Bakukube bakwize ti oli munoni. Omukolo bagukolere.
Olina kwandula.
Olina nankani bya wedding.
Olina graduation.
Ni bobo firirwa. So kwenda kukola nankani send off decent.
Wesimbye omukalulu.
Decent.
Funaba Ikop.
Abo bulwo bayito bataako.
Tubateeko tuli kujja mu kulonda.
Era tibasasula.
Be.
Kale.
Sasula.
Olikwenda bya bululu.
Yes.
Bakukube mukuba ni poster.
Ate bana.
Mukuba poster.
Olikwenda bana.
Bana dinedo kubutundu bali. Mu poster anguli mutunigira muko chali wife.
Ani. Chali wa imazira sente. Yasina n'okumuyamba oyo omusaada. Ikop.
Eri ekindi aba Ikop.
Olikwenda poster.
Kale.
Bana. Butundu bali. Billboard. Jamba na ife aba.
Business card.
Mudikola. Nti naba akole ne ya.
Nedo debeta bolochuwa.
Bolochuwa dindi.
Bolochuwa chechimu ne business card.
Ate kalenda.
Muwandika ku t-shirt.
Follow us on Instagram at Ikop Photography or call +256 702 935 078. Don't forget, they do it smart. Book with us today.
And branding at Print Creations. From custom gift sets to unique promotional items, creative signages and general printing, we've got everything you need to elevate your brand. Visit us at Chum Towers, Suite 70 on Kuruma Road, Lighthouse, Suites D14, D15 and F13. We offer a wide range of stationery supplies, awards and a vintage collection that stands out. Call us today at 0934 893 333 or WhatsApp 0702 683 317. Follow us on Facebook, Instagram and X at Print Creations. Print Creations, where quality, excellence and uniqueness meet.
The short and big shot.
Omumwa gonfukidde omumwa Zubedah. Candle night ogimanyi. Bagita candle night bw'okutte gw'obba.
Washuga teyamaliranye ku live.
Pamoja ekiri.
Bendera ddala.
Omusajja ate nga anaakuswaza ajja kwana black sugar.
Abasajja munyiga nga tebakati.
N'oyingira n'atakubuuza. Ekibonyaabonya ababooda abasinga. Financial literacy. Oli abeera n'etaano ate nagenda n'akwanamu. Ddala mutabani wange wakati w'emyaka alina okuba ng'ekyalo akikuttemu ekitundutundu.
Anayakola kimpanya n'alagako nno panda nti si wa muzannyo.
Ate kyenayagala ku ttiimu ya Mama Fin.
Sente eziwaayo.
Naye tebasaba njawulo.
The short and big show. Abantu bajaagalira ddala. We always love you.
Hey yo, what's up my people? This is the baddest Azawi right here on Executive Media with RealTime with Mimi. Stay locked in. Yeah.
Yes.
Doctor, can those fibroids be transmitted sexually?
But
still, because regarding the other interview I had that was circulating all over, so people are scared, people are saying, hospitals, amalwaliro gatubba, all that money. Now, today I said I will ask Dr. Eladu our question. Doctor, we have a problem. Now, I did an interview with someone, but they told us something scary about pregnant women and us mothers. They told me, you doctors, when we give birth, you sell our placentas to rich men, rich people out there. They eat placentas. and we sell them over 50,000 US dollars. So they told us to start demanding our placentas after birth. Are we supposed to demand the placentas, or we are not supposed? Then can a placenta be eatable?
All right. So there are so many practices about placental care for over generations. You get it? And in our setting, there are people who have rituals they do on placentas. There are people who bury placentas. There are people who do so many things on the placentas. As families, you get it? Eh? Now, in developed countries, placentas are not ideally discarded. Okay? They use placentas for stem cell research, okay, in developed countries. So the placenta is a very important structure because it contains cells that can help you in the event you get cancer and all that. Those cells can actually be used to sort of manage you during that time. That's how simple I can say it. So developed countries don't really discard placentas, you get it? Now, in our setting in Uganda,
Yes.
most hospitals do not have capacity to do research on placentas, right? We don't have that capacity.
So where do you put them?
So like all medical wastes that we don't need,
You burn
we
them.
burn them, okay? We have, most hospitals have what we call incinerators.
Yes, I know.
Where we burn wastes, medical wastes. But companies that deal in medical waste, where they can take the medical waste and burn the medical waste, you get it? So most hospitals discard. And usually my discussion with the patients during the antenatal is, what do you want to do with your placenta? Okay. So I ask you.
I want to put them in the plants. They told me placentas with plants.
So you see, everyone is entitled to what they want to
So
do.
I can ask for my placenta.
You can ask for your placenta. In fact, I've had patients who have asked for placenta and said, doctor, they even come with their bucket and say, doctor, placenta.
Put the placenta. Subira buli omu ali bulungi kamera nkula.
Akulindemu omuntu bw'aba akola mulindi.
Wadde ogamba ki wamma? Okay, kasubire mwasize bulungi eno executive media nga bulijjo ndi ne Dr. Eladu tuli wano ku TMR Hospital Enaalya. N'olunaku olwaleero era nzize okubeera ng'ate tunyumyamu nammwe omwami n'omukyala. Omwami kikkakatako okubeera ng'akwoli okumanya bino kikuyambeko okubeera nga mukyalawo singa abaafunye obuzibu obwo omanyi w'oyinza okubeera nga otandikira. Dr. Eladu yatuwaayo olunaku lumo mu wiiki okubeera nga ate tumubuuza ebibuuzo kyekintu ekisinga okunkolera era Dr. Eladu, thank you so much. Mothers they are so happy. So olunaku olwaleero tugenda kubeera nga twogera ku fibroids, but before we talk about the fibroids there are some comments that you sent in zenjagala Dr. Soka abaddiremu nga tetunnaba kugenda ku fibroids, but you can still be sending in your questions. Ngenda kubawa app ya TMR bajja kubanga bw'oba olina ekibuuzo kyoyagala okubuuza osobola okukuba oba okusindika comment yo ku app eyo n'osobola okuba nga ofuna quick answer amangu ddala okusinga wano ewaffe nti oyinza ogiweereza ate we tunaafunira dokita wiiki eri abadde alonda. Dokita kulikayo mu kulonda ne mu lockdown. So producer, send me those comments. Tulaba ate bwe tubuuza. Dokita, waliwo omukyala. Good morning.
Good morning.
How are you?
I'm fine, thank you, Zubedah. How are you?
I'm fine. So waliwo omukyala abadde abuuza ekibuuzo kino kirabika oba bagiyita PCOS?
Yes.
PCOS. PCOS.
Yes.
She has been sending in that comment for a long time.
Okay.
Simanyi oba ayina buzibu bambi. But what is it? Because she said you should talk about it. She has been facing it for so long. Ate bagamba sugars zo baziri ku 4.8. Does it have anything to do with blood, with sugar?
All right,
with diabetes? Or?
Sure. So PCOS is one of those common conditions in women that is linked with hormone imbalance. Okay, and it's very common that women who have irregular periods, okay, they skip periods, skip 2-3 months, get periods. The commonest reason for that is mostly what we call PCOS or PCOS. So it's basically a syndrome that is associated with having so many cysts mu ovaries. Okay, so sometimes if someone does a scan esobola okulaga nti ayinawo cysts bungi mu ovaries. It can also present with having irregular periods. Some people may go months without having periods, or they can have very little periods, scanty periods. Someone gets spotting, enaku nga bbiri ngafuna just spotting nga period ewedde. And then sometimes, because PCOS is a hormone related condition, some hormones are not in the right levels. So these people tend to have maybe a bit of more testosterone, which is hormone of men, than estrogen. So they may have symptoms associated with high testosterone, nga pimples. Some get pimples, wakwera ne hair under the chin, hair on the chest, very hairy body and legs. So that is really because it's a big topic. I think we shall get some time. Then we speak about it in detail, but that is what PCOS is. And so hopefully that a person can tune in, and then when we get to talk about PCOS, we'll be able to really explain the details of it.
Okay. So another question, another comment was Zubedah. Doctors should help women with their options to conceive after 35 years of age, because as statistics has shown, women are now increasingly starting families after 35 years of age.
Sure.
And that is true.
It is. It is. In fact, there's a shift from the 20s
to 30s.
Really to the 30s. So in terms of fertility and conception, there is a whole range or cascade. For example, what is a fact is that if a girl is being born, that girl is born with all the eggs she will ever have. Right? She's not making any new eggs. All the eggs you will ever need. Yes. In fact, those eggs are formed around the fifth month, fifth month of you being in the womb. Then by birth, they're about 20 million. By the time you start your periods, you have about 400,000 of those eggs. So those are the ones that keep on getting reduced every month until you reach menopause. So we still emphasize that the best window for conception is in the early 20s, or 22, up to 35. That's usually the best time, because that's the time you have the best quality of the eggs. Now after 35, the number of the eggs sharply reduce. What causes it, we can't tell, but we think because the eggs have stayed for a long time, so they get depleted. Number two is that the quality of the eggs nazo zikendera. So you find that the quality of someone's eggs above 35 are not to that one below 35. And then of course, the more you approach menopause, the less the quality and the less the eggs. So our advice is, one, to try as much as possible to have children early, because we know that the more you approach menopause, these poor quality eggs can result into having abnormalities. Okay, if you end up giving a child who has defects mumutima, in the head, in the brain, in other organs. So it's just science, it's statistics that we recommend earlier. But it doesn't mean that if you give birth, yes, that you can get the abnormalities. In first world countries, they usually do assessments to make
of
sure
the eggs.
of the pregnancy with still small. In fact, they even assess you before you get pregnant to see if you have any risks of having defects in family, minor problems. So that is a risk already. Okay, so it means that such a person needs to conceive early when the quality is still good. Our advice is, if you are really career oriented, you can freeze the eggs. Okay, freeze the eggs early, before maybe 35, or if you realize I'm taking long and I'm still pursuing other things, jangu, we freeze the eggs, we keep the eggs. So when you want to conceive, you use the eggs when they have actually at that age, because when you froze them at 30, the eggs stay at the quality of 30. So when you want to conceive, that egg is much safer than when you come at 49, 50 and you want to conceive. You get it? So egg freezing is then, but also just a healthy lifestyle. Make sure you are having a very good lifestyle. You're exercising, your nutrition is very good. For those who consume alcohol, you're taking it in moderations, because alcohol can definitely affect fertility. Those who are doing other substances, maybe smoking and all that, that you really don't do such things, because those are things that can deplete your eggs faster and reduce the quality of the eggs faster. So just lifestyle. Make sure you're living a very good lifestyle, and and then when you plan to conceive, there's what we call preconception care. Come and we just talk to the doctor and say, now I am ready. I am 40 years of age, I am ready. What should I do? Okay? Before you conceive. Because sometimes we put women on supplements that can help them improve the quality of the eggs as well, but also to improve on the chances of getting a healthy baby. So just seek that care early. Come with your partner or come alone. The doctors, especially the obstetricians and the gynaes, can take you through preconception care and then just prepare you. So that you have a prepared pregnancy than just getting pregnant and then you have these things.
Okay. So eyabuziza kyekibuuzo ndowooza dokita akuzzeemu bulungi gwe atategedde aliwo abacomplaininga ku luzungu. Gwe atategedde dokita agambye kyandibadde kirungi nnyo omukyala n'ozaala before 35. Bw'oba tosobodde jangu bafreezinge amagi. Bw'onootuukira okuzaala obeere ng'ozaala omwana ali healthy. Wabula tekitegeeza nti buli azaala ku 35 and above azaala omwana ng'alina abnormalities. Naye nga kyandibadde kirungi n'ozaala before 35 amagi ago ne gaba nga gakyali malungi nga gakyalina mu mbeera ennungi. Naye nga osobolera ddala okuzaala ku 35 saagala muggwemu ssuubi. Wabula agamba bw'oba osazeewo nti kati ogenda kuzaala above 35 kirungi nojja you consult a doctor ne bakuteeka ku supplements ne babeera nga bakumonitoringa from day 1 mpaka osobole okuzaala omwana ng'ali mu mbeera ennungi. So olwaleero tugenda kwogera ku fibroids. Gwe alina ebizimba oba gwe alina omuntu ng'alina ebizimba mu lubuto, Sembera teekawo ekibuuzo kyo, teekawo comment yo. Dokita leero agenda kuba ayogera ku fibroids. So doctor, leero ebibuuzo byange ngenda bikubuuza mu Luganda. Yes, abakyala bacomplaininga. So for you will just answer in English. Maybe I can take some time and translate for them. So ekibuuzo ekisooka doctor, fibroids zijja lwaki? Lwaki abantu babeera ne fibroids?
So I think we start with really understanding what are fibroids.
Yes.
Okay? Because the question is, omuntu agenda mu ddwaliro n'akola scan, then they tell them we have fibroids. So what is it? Okay, how do you understand from that point? Fibroids are swellings. They are firm swellings that grow munabana. Okay? So they are just swellings that grow in the uterus. Okay? And they do not cause cancer. All right? So they are non-cancer swellings zikulira muki munabana. Now, how do they come about? All right? Because the biggest issue is, how did I get these fibroids? Did I get it from somewhere else?
Tuzaalibwa nazo tuzijja ku bazadde baffe bazituloga. Like so, they bewitch us.
So if anything, they are the most common conditions among women. In fact, statistics show that over 50 to 70% of women can get fibroids by the time they reach 50. Okay. So they're really, really common. And they're more common among blacks or people of African ethnicity compared to the whites and the other races and all that. So they're very common. And one of the things, because the exact cause of fibroids is unknown, but we know that there are what we call risk factors or things that have been suggested. For example, genetics, family. Okay? So you can be there, ne mama yali alina fibroids, oba senga. Okay? So you find that tends to follow genetics. So meaning that there's a genetic risk of someone. If mommy had fibroids, now we now risk yochi, yofuna fibroids. Okay? So genetics. Number 2, vitamin D deficiency. Eh? Vitamin D is what we get from the sun. Now,
Yes.
what is being suggested is that among us who are blacks, very black, our skin is pigmented, and that does not absorb enough vitamin D compared to those who are white or light skin and all that. So that's reduction in absorption of vitamin D. Vitamin D is helpful for controlling of certain growths, for example, fibroids. So most studies have shown that our child reduced vitamin D levels tend to have more risk of getting fibroids than those whose vitamin D levels are actually improved or better. All right, so that's why they're associating it to our skin color for us, if we're very black. The other one is also prolonged exposure to the hormones of menstruation. Okay, so meaning that when you conceive for the 9 months, those hormones are not as at those levels compared to someone who has not conceived. All right, so that's why normally people say that pregnancy is protective against.
Nga nti funa olubuto bigende biyiike.
So pregnancy is protective against the fibroids. Okay, so people who take extremely long durations without the conception means that they get exposed to more of these hormones than the person who actually got pregnant. So again, yeah, that's why people talk about pregnancy and fibroids. And then of course age itself. It's very rare for you to find fibroids in people who are less than 20 years of age. But then in people who are in their 40s and 50s, the age also comes. It's a risk of actually someone getting the fibroids. So those are some of the risk factors. And then of course we see things like diet, right? Or where we look at things, foods, for example, red meat, or foods that are dairy products. They tend to contain substances that can disorganize the balance of the hormones in the body. So those are some of the risk factors that we can really mention about, but by far we have not pinpointed into this is the exact cause. We just know that there are risk factors that can result to someone getting
Okay,
fibroids.
so oyogeddeko ku dairy products.
Yes, yes.
Which dairy products ezo z'olaba nti
So mostly milk and meat, red meat.
Red meat.
Yeah.
Yeah.
Because then they may affect especially estrogen. I thought, normally of course I try to teach, but this is just an image. If you look closely, you will see, Zubedah, that this is structure of the female reproductive system.
Yes.
Okay? Waliwo simanyi oba okyajukira ka ovary kali wano zino ziba nseke, the fallopian tubes. Right? And then, so these fibroids start to grow from the muscle. Okay? Because the uterus has many layers, many layers. So you find that these fibroids usually grow from the muscle layer of the womb. Okay? So they start as very small growths, and they can grow at any point of the muscle layer. Now, as long as the woman keeps getting her periods, buli mwezi, there are hormones that are reduced or that are released by the ovary to help the uterus to prepare to receive the baby. Okay? Those hormones are mostly estrogen and progesterone. No need for you to remember those hormones, but just know what are hormones that are released from the ovary as again mu uterus to prepare it. Those hormones, as they prepare the uterus to receive the baby, they are the same hormones that make the fibroids to grow. So meaning that kastango chagena mu period, if you still get your periods, there will still be hormones that are being released, and then there will still be a growth of the fibroid. So sometimes you find that someone has a very small fibroid.
Yes.
Okay? But because of time, the fibroid keeps on growing. After a few years, it has increased in size. Okay, so it keeps on increasing in size. What to say menopause? When you reach menopause, then there are no more hormones coming from the ovary. Then the fibroid stops growing, and some of them even start shrinking.
So they can shrink.
So they can shrink, but when you don't have those hormones coming in, so most likely menopause, right? You end up actually having them shrink in size. But as long as you're still in your reproductive age, you're still having the menstruation happening, okay? Those hormones are still, they will keep being released, and then they will actually cause the fibroid to increase in size.
So doctor, what are the early signs?
Very good.
The early signs of me knowing that now I might be having fibroids.
Now, there are women who have no signs. In fact, over 50 to 60% of women are in fibroids. They are in a sign yonna.
Hey.
Yes. Some of them we actually get to know ntivayina fibroids accidentally. Maybe she has come, she's pregnant, I want to call out a scan. Then you say,
Fibroid.
a fibroid. Or someone comes for other things, oluluma, netugamba kale katukolewo ka scan. Then say, hey, did you know you have fibroids? Nagamba nera musawa simanyi. So majority of women abayina fibroids tebawulira kintu kyonna. They don't feel anything. So that category of people are said to be asymptomatic. Kitegeeza nti tebalina symptoms. Okay?
They don't even get any pain.
Nothing. Very fine.
Never again on periods.
Perfectly fine. So there's a small percentage about...
So they can be there without you feeling anything.
Yes, yes. They can be without feeling anything. And actually, for us as doctors, we don't worry so much. When someone doesn't have symptoms, I'm not so much worried about it. We only get concerned in terms of symptoms. Because now there's a small category of women who have symptoms in fibroids. And the symptoms are linked with, again, the location of these fibroids. If you recall, we said that there are about 2 or 3 layers of the uterus. There's a small layer outside one. There's a muscle layer. This is the one which contracts. Muscle layer. And then there's the inner layer, which is shed. Period. There is that layer that is shed. So the symptoms of the fibroid come from this structure. When the fibroid starts growing in size, because most of the women who don't have symptoms, most of the fibroids are small. Now, when the fibroid starts to grow in size, so even the uterus becomes big. If the uterus becomes, normally we say the uterus is the size of your fist. When you're the normal uterus, without any issue, about the size of your fist. Okay? Usually, when you reach menopause, then it reduces, shrinks in size. But when fibroid starts growing, so it keeps on increasing in size and increasing in size. So now that's where the symptoms come from. Because if it is wider in size, bleeding area evan nene. So that person will start having heavy bleeding. Okay, so it starts affecting the periods. So the first signs are usually mu period. Normal period should not go beyond 7 days.
Yes.
Okay? Naye kati go oliawo ennaku 10 weeks bleeding oli mu period.
You're not on family planning.
Toli mu family planning. So that should be a reason for you to actually come on. Some people even get bleeding nga tebali mu period. You've finished your period, then in between, no damu, no funauka bleeding. Okay? So it causes abnormal bleeding, it causes heavy menstrual bleeding. And number 3, it can also cause cramps. Because this uterus, when Ogenze mu period, the uterus has to shrink, to contract. As a contraction, yamba ukendera bleeding because it ties off the bleeders munabana. So if the uterus is contracting and it finds that there are some rocks or stones, the muscle layer has pain receptors. So when those rocks are contracted against, it triggers off painful sensation. So this person will also feel a bit of pain, too much pain in period. Okay, so we've talked of bleeding, we've talked of painful periods.
Yes.
And because of these symptoms, this person may end up being anemic. Kubanga buli period gyofuna obuliringa nnyo, so that already makes you weak. Obeera ng'owulira entunusi, kamunguluzi, you can't do anything, you're feeling weak because you've lost so much blood. Okay, so those are symptoms. Then also, there are symptoms that are associated with the effects of the fibroids to the neighbors. Because the uterus is isolated structure, I know neighbors. Once wa uterus, waliwo bladder. Behind the uterus, waliwo rectum, where the stool passes. On top of the uterus, waliwo ebyenda, intestines. Okay? So, if this structure starts kuzimba, kitegeeza nti it can affect the bladder muscle. So that person will not be able to hold urine for long. Buli kaseera the person is urinating all the time. If the uterus is pressing the rectum, or yatandika kuwulira constipation, so you find that you are experiencing constipation, all right, because of the fibroids, but also pain. Once you start feeling a bit of pain because you're pressing the intestines and other neighbors. So you are there, period night, just totally fine. And of course, in some people, the stomach starts okuzimba. Because now if the fibroids are increasing in size, it starts expanding. Sometimes you see someone, you think they're pregnant, but they're fibroids. I've seen someone whose fibroids have been pregnant. Look, almost at the level of the what? Of the umbilicus. You may think they're 7 months or 8 months pregnant. Fibroids. So that means that zitutebanga, they've been really growing and growing, and you've not really done anything about it. And then, of course, finally, there are people who find challenges with the fibroids. Why again? Because these fibroids make this uterus a bit difficult. Sometimes I tell people, my patients, I tell them, the uterus is like a garden. You have a garden there. Okay? That garden should be able to grow maize. Okay? Now, if you have stones in the garden, rocks in the garden, will the maize grow? So sometimes the maize may grow, but it will stop growing after some point. Okay? Or, so even for women who have fibroids, you'll find that some of them even get pregnant. But because there are some fibroids in the area where the baby is trying to grow, it makes it very hostile for the baby to grow. And that person gets a miscarriage. So the baby has come out. So that is
because of the fibroids.
Because of the fibroids. Okay, but that doesn't mean that every person who has fibroids gets a miscarriage. Not really, but it can happen. Sometimes, fibroids zikulira wano kumpi n'oluseke. So in doing so, they can block the tubes. So the sperms can't find anywhere to actually pass. So that person struggles to conceive. So those are the different category of symptoms that this person experiences. Okay, but normally the bleeding issues come first, then the pressure issues because of the size of the fibroids. Then also we can have fertility issues.
Okay. So, Doctor, omukyala ali akkiriza nti kati alina fibroids. I've acceptance first that I have the fibroids.
Yes.
How can I treat the fibroids?
Again,
how are they treated?
Yes. So, fibroids, one, it's very important that you investigate, scan. Okay. So for us to treat, we want. What I tell patients, and usually this is the standard. What I tell patients is that it's very important to know nti oyina symptoms or what oyina symptoms. Kubanga you can be there and you have no symptoms, and you found out nti your fibroid is 2 centimeters. That's a small fibroid, okay, and it's not causing any problem. So for that category of people, we don't do anything, okay? We just monitor. So there's the first part of managing fibroids is knowing the symptoms and knowing if they affect the quality of life of this person, okay? If this person is fine, taina pain yona, and she's conceiving without any challenge, yes, we say no problem.
Monitoring.
Yes, you come back after every year or 6 months, netukolawo ka scan, and we find out are you feeling anything? Okay, buli kimu kiri fine. Kale tukebedde the fibroid, it is still 2 centimeters, so it has increased by 1 centimeter, but you're not feeling anything. Dayo waka, you come back after another 6 months or 1 year. So we can do that follow up, okay, because we know that when you reach menopause, most likely this fibroid will stop growing and even shrink. So not every fibroid has to go for surgery. So the second category of people who have symptoms. Be bleeding nnyo, okay, who feel too much pain and all that. And sometimes again, it's not necessarily the size of the fibroid. It's the symptoms that is more important. Size, yes, plays a key role, but because you know, the bigger the fibroid, the more the symptoms, like we've seen. So if someone has the symptoms, I usually ask them, are these symptoms affecting your quality of life? Okay? Do you find, kubanga I get patients who get transfused Zubedah buli mwezi agenda mu period bleeding nnyo, nafuna anemia, nafuka weak nnyo, oyo tulina omumwa musaayi buli mwezi. So that is already affecting your quality of life. Wala abantu bafuna kasita nga bagenda mu period, they can't do anything else. Abeera waka, too much pain. All right, they are in their beds, they are in hospital, so that is affecting the quality of life. Then there's some people, yeah, they bleed but not too much. The pain is bearable. They take a painkiller, na gain a muscle. All right, and they are conceiving well. Tebaina problem you now. Okay, so those ones we talk to them and say, Mkwano, okay, basing on your symptoms, we can choose to manage you symptomatically. Okay, sobola mwayo Edagala esobola kendeza bleeding ngagenda mu period, so that they don't bleed too much. We can give you medicine to deal with the pain in the period, so that you're not in too much pain. We can also give you supplements to improve on the blood levels, okay, so that you're not anemic. Okay, so we can handle the symptoms. There are other, for example, there are some studies that were showing that family planning pills would help control the fibroid growth, but in some people it makes them grow. In some people it doesn't. So again, we are not so much there. There are also certain, for example, the hormone IUD used to be suggested that it can also control the growth of the fibroid, but that doesn't happen for everyone. So we explore the options. What can we do? What can we do? What can we do? Especially if the symptoms are not severe. Okay, but if you are in the third category of people, awaina symptoms that are severe, nga your periods just scare you, or you are not just living a very good life, then you fall in the category of surgery. Okay, so now those ones are the ones we discuss and say, or even you're trying to conceive but you're failing to conceive, then do you still want to give birth? Okay, because you may have fibroids and you've given birth to 4 children. And you do not already have any other plan for you to conceive, all right? And you are maybe 48 years of age,
okay,
all right? So that question is very important, and your doctor should ask you that question so that you are able to really talk to him honestly. If you really want to give birth, it means that whatever we do, we should just remove these fibroids, all right? So that surgery of removing fibroids alone is called myomectomy.
Mymectomy.
This is whether you're smart.
Yes, doctor, very smart. Very soon I'm doing medicine here at
yes. So myomectomy means that we remove the fibroids and we remove as many as we can.
Many?
Yes, because the scan that you do, only shows the big fibroids. So
this one only.
So scan can show into one fibroid. Even gives you measurement, nagamba, maybe 4 centimeters. But most times when we go ahead and call a surgery, we may end up removing 15. Why? Because I want to remove even the small ones that are beginning to grow so that they don't grow. So we remove, you can see these ones of different sizes. So we remove as many as we can so that your uterus is free from fibroids.
So doctor, fibroid.
And then also we look at the position of those fibroids. There are certain fibroids that can be in very dangerous positions that can put your life in danger. Sometimes we don't remove those ones. Or if we think the fibroid is so close to the tube that removing the fibroid can make your tube blocked, we may not remove that fibroid. You get it? Yeah, but your doctor, or what we do as doctors, we try to remove as many as we can. So scan is 4 fibroids, you remove 20. Sometimes we've removed 30 fibroids from just 5 muscan. Okay? Okay, so that's how surgery is important. So you remove as many.
Someone can be with 30 fibroids.
50 mkwano. All right. So that surgery of removing fibroids is called myomectomy. So after removing the fibroids, we repair the uterus so that it can heal and you can get pregnant and have your babies. All right. That is myomectomy. Number 2, there are people who have reached a point tebachayagala kolachi kuzala. So those ones can all now there, because we know, unlike for myomectomy, because even if I remove as many fibroids as possible, some people, not all, some, about 3 out of 10 women can have some of the fibroids growing from other places, not from the ones we removed from. Okay? So there are some people who may have a recurrence, and we tell you this before surgery. But some women come and say, doctor, I did surgery 2 years, 3 years ago. Okay? So most likely they're not cancelled. Removing the fibroids is to relieve your symptoms, because once you remove the fibroids, the bleeding reduces. Ne pain candida. All right? Yeah, and you get to live at least a normal life. Okay?
Yes.
So the reason for removing the fibroids are to make sure you feel better.
But not to cure.
Not usually to cure, because as long as you still go into your periods, there's still a possibility that you may still get a fibroid to grow. But that doesn't happen for everyone. There's some people you remove the fibroids, never wanna bulungi. Nebitadda. Yeah. So we remove the fibroids to treat the symptoms. Okay? So that is one category. The second category are people who don't want to give birth. They have reached 50, bali mu menopause, or they are 48, and they have the children are telling themselves, Neda, me, I just want these things gone. Those ones we discuss with them about removing their whole uterus. Yes. Because tewachayagala kuzala. And also it has a benefit, because when we do the removal of the uterus, we can protect you from cancer of the cervix. Okay? The cervix is somewhere. So when you remove the uterus and the cervix, you don't have to ever worry about cancer of the cervix. Okay? You don't have to worry about cancer of the womb. And or if you are in menopause, we may even remove the ovaries. So it means you don't even have to worry about cancer of the ovaries. Okay? So it means that when you remove this structure, which you don't need anymore, then your quality of life improves greatly. You can now do whatever that you never used to do.
But doesn't that affect my health, removing the uterus?
Ideally, we are doing it to improve your health.
Oh.
You get it?
So when someone does not have a uterus,
yes,
is it okay health-wise?
Yes. It is very safe for that person, because when you reduce the risks of cancers, uterus, cancer of the cervix, cancer of the ovaries and all that, you've lowered the risk.
So you don't feel empty?
You don't feel empty. The other thing, of course, people worry is that, can I still have sex well?
Yes. And where does the what? The semens go?
No. Your worry is where the semen enters.
Hey,
no.
Won't they come on my heart?
Because when we remove the uterus, we close off that upper part. So the semens will stay in the vagina.
They don't go anywhere.
Don't go anywhere. Yeah. But this is a discussion that we really have with people, and make sure we counsel them, tell them the benefits of this surgery, tell them the likely risks that can happen. Like every surgery, there are risks that can happen. Tell them the outcome of life after the surgery. Okay? Yeah, but the goal of this surgery is to make sure you feel better. Okay? Not to make your life terrible. So usually I tell patients, my goal is to make sure you are feeling better, that every day you'll be thankful that, Kale, now my life is better. I can do other things without worrying. So those are the surgeries that are involved. And those surgeries don't have to be done as open surgeries. Ennaku zino tulinawo advancements tukola laparoscopy. Laparoscopy ekitegeeza nti we put some holes mu lubuto. They're just very small camera holes, and we can remove these fibroids from. Camera. We use a camera in the stomach, okay? And then we know where the fibroids are, and we remove them and close that area. Remove and close, remove and close, okay? And then we have a way of removing those fibroids from the stomach. And still, any cut. You just have a small punch hole. Even the uterus, we can remove it laparoscopically. Yes, without
Because you
necessarily.
said it is small.
Yes, it's a very okay. So laparoscopy is a very good. So for people who are scared into, I will not I will not have a very nice stomach and all that. Neda, you will look really really fine. People will not even know it. Then, finally, there are newer methods that are still experimental. More fibroid management. Okay? For example, one method jebaita uterine artery embolization. Don't worry about the name. But what it means is that they inject medicine, Zubedah, they inject medicine or they put medicine that blocks off blood flowing to the fibroid. Okay? So it means that if you cut off blood going to the fibroid, it chakura. Okay? Then it starts shrinking and reducing in size. Okay? So that is one, uterine artery embolization. It's a newer advancement and
you're still working on it.
Yes. Okay? And some people are even experimenting. Although, of course, for people who still want to give birth, we try to not encourage them to do this.
To do it.
Yeah, because sometimes we find that it affects the uterus and then they struggle to conceive after and because of that procedure. But uterine artery embolization is here, and I think there was a time there was a camp about it and all that, but people should be aware of uterine artery embolization. Number two, there's what they call magnetic resonance scanning. Okay, so what to cause a scan, the scan tries to hit the fibroids. The waves from the scan try to hit the fibroids to help it shrink in size. Okay? But again, I've said these are experimental methods that are out there. Okay? They are not yet widely used. Even in first world countries, they're under research. So people who enroll for this, they're mostly being considered under the research. Yeah.
So, doctor, I have a friend of mine. She has been operated once, and they removed a big fibroid from her. Now it is 5 years that she's experiencing another fibroid, but she cannot conceive. She's approaching 40. What advice can you give her? She can't conceive.
So, when we are looking at not conceiving,
yes,
we are looking at the three areas of the womb. Of the system. We are looking at the ovaries, we are looking at the tubes, and we are looking at the uterus.
Yes.
Those are three areas in women that can affect fertility. Kati, if someone has a problem in the uterus, of course we want to address it. Well, it's about fibroids, we want to remove them. There could be polyps and other things, we want to remove them. But also we want to check the other parts. We want to check if the tubes are open. Because you may have more than one issue. Okay? For us, you may be focusing on the fibroids. The tubes are blocked. Okay? So it's very important that she has to really come to or go to a fertility specialist or to an obstetrician in that area of fertility. Nakola, what we call evaluation. What else is causing this
apart from the fibroids?
Apart from the fibroids. Because like I said, Zubedah, before, people conceive with fibroids.
Yes.
Okay? If the fibroids are small, people even carry their pregnancies. Even when they're big, there are people who carry their pregnancies. Despite being a difficult pregnancy, because if the fibroid is there and the baby is there, as the baby grows, sometimes the fibroid also grows in size. Okay? And usually when the fibroid grows and the uterus is overstretched, someone may experience too much pain in the pregnancy. So there are people who really struggle with the pain in the pregnancy and all that. But eventually they carry the pregnancy until they give birth. Okay? Yeah. So it may not be fibroids alone. Mugamba aje kudwaliro TMR or whatever she's comfortable with. Then we do a proper evaluation. Okay? And apart from just fibroids from her. But sometimes even the man could be responsible. You get it? Because it takes two people to get a baby. So if you may find that you solve the problems of the woman, but on the other side, the man has an issue. The sperms can't swim, or the sperms are few, Okay, all the sperms have abnormalities, and these are things that we can try to address. Okay, so male infertility is on the rise. Many men are having issues trying to conceive. Okay, and they are actually afraid to come for help.
Yeah, but if a man hears that a woman has fibroids, obviously he cannot come to the hospital.
No,
There is
and my
already
message,
a big problem that the woman has fibroids.
And my message to the men out there is that you can conceive with fibroids. So if your wife is not conceiving despite having fibroids, come with her, be supportive. Because when you support the woman in seeking the care, then the doctors can do a good job. You get it? Sometimes you check the woman, and to be fair, she has no problem.
Apart from the fibroids.
And when you remove the fibroids, it means that you have addressed the fibroids. You get it? Eh? So it's very important that the men are supportive. Fertility treatment is best addressed ngachi nga you come as a couple.
Men.
Yes.
Doctor, they don't want to come to the hospitals.
No, but now the
even treating them infections.
Yes.
They don't want.
But I think it's changing, because I think many times they don't have the information. They have been using the rumors and all that, but now the information is there. Okay, it may come from these sessions that we are having, but others also could be from YouTube, from Google and all that. But when you come for treatment as a couple, it really helps. It helps the doctor. It helps you. Even you're able to understand what is wrong, and you're able to know what to do as a team, instead of someone coming alone. Cut now for her, she has checked in tiny problem yonder. Now she's looking at you. She's wondering, and for you, you're just walking around. You think you have no problem.
A man home.
You may even think you have a baby who is 6 months. You never know. Okay, let's not go very far.
So, doctor, I have a friend of mine. She's a celebrity here. I did an interview with her. She told me she was 3 months pregnant, and they checked when she had fibroids. They operated her, they removed the fibroids, and then they put the baby again. Is it possible? Bamujam fibroid, nebazama omwana.
So
Bamukola operation when she's pregnant.
So, truthfully, we are not in the habit of doing surgery when you're pregnant, especially to the uterus. We are not in that habit because it's risky. Any disorganization of the uterus can affect the pregnancy. All right? Now, if you look at this again, this is a picture that shows the different places the fibroids can occur.
Yes.
All right? There are those that grow towards the inside. There are those that grow towards the outside. But mostly there's this one here which is hanging outside. This is called a pedunculated fibroid. It is a hanging fibroid. Sometimes when the hanging fibroid twists, okay, when it twists, it can cause too much pain in a woman.
She told me she had too much pain.
So when we do a scan and we find out that what is causing this too much pain is a hanging fibroid, because we know the hanging fibroid will not affect the womb that much, that is someone that we can take in theater and we remove the hanging fibroid without you touching the uterus. So you just tie it off and remove it.
So
the uterus stays. So you don't touch
the baby.
You don't touch the baby. Because once you touch the baby, open the baby and all that, then that pregnancy is going to fail. Okay? At least in our setting, we do not have that technology yet. Okay? I know there are scenarios where doctors have done surgery on a baby in the womb. Okay? I think that has happened in the US before. All right? On a baby.
But not here.
Not in our setting yet. Okay? So if the fibroid is a hanging fibroid, and it is twisting, and it's causing too much pain and you're pregnant, we can remove it so that the pain goes away and then you carry the pregnancy. Okay? And in fact, since you brought that, there are women who ask, so if I have fibroids, and I'm pregnant, can't you remove them when you're delivering the baby?
Yes.
So the answer is no.
Why? Again, you're already doing a surgery. You've opened the uterus is open, everything is open. When you're removing the baby, please remove all those fibroids.
So it's recommended, because when you're pregnant, there is too much blood flowing in the womb.
Yes.
Too much blood. In fact, every minute it's almost 500 mils of blood. So meaning any danger to the womb, you can lose all the blood you have in 10 minutes. Yeah. So the pregnancy is a very sensitive condition. Number two, fibroid surgery is associated with a lot of bleeding. You get it? So because of that risk, when you're pregnant, our emphasis is the baby,
Not the fibroid.
not the fibroid. When we deliver the baby, we stitch you up and you go back home. And the reason is because after you've given birth, the blood flow to the uterus reduces. Sometimes even some fibroids reduce. I've seen mothers who had fibroids when they're pregnant. After giving birth, some of the fibroid disappeared. You get it? So we assess you later. 3 to 6 months later, you come back and I assessment and it's okay, twin fibroids maker. Can we prepare for this surgery? At that point in time, your body is ready for that surgery as compared to when you're pregnant. But if you do that surgery when someone is pregnant, you put their life in danger. And sometimes either the person can lose too much blood and die on the operation, or you may end up removing the womb. You've delivered the baby, you're trying to remove the fibroid, the blood too much. Now to stop the bleeding, you have to remove the uterus. So you have caused that person harm. You've removed the uterus. They can't have any other children.
Without her consent.
Without her consent. You get it? So the advice is if you have fibroids and you're pregnant, for us, the doctors will be interested in the pregnancy until you deliver. After you've delivered, we wait for you to recover from the pregnancy so that to see if you can now handle that second surgery.
Okay.
And we don't have to cut you. The second surgery may even be laparoscopic surgery, and we remove them without making another incision.
But isn't it expensive?
Laparoscopy is now affordable.
Okay.
Is now affordable, and many people are actually doing these surgeries. Okay, so they're quite affordable. You should not be afraid out there. Come, inquire, let them let you know how much it costs, and you prepare for it.
Okay. So ina fibroids, doctor agezezaako okubeera nga abannyonnyola nti tebasobola kujja mu fibroids nga ozaala. Oba olina okulinda n'omala okuzaala n'owona n'odda ne mulyoka mutandika okwogera ku kyokubeera nga ate okola operation ya fibroids. So doctor, can those fibroids be healed with local medicine, herbs?
That's
Edagala egganda liwonya ebizimba.
That is a question that is a bit it's interesting because sometimes I tell my patients, you have fibroids, and they say, I'm going to take herbs. Now, of course, the truth is that we don't know much about herbal medicines.
Yes.
Right? We really, really don't know much. And of course, the emphasis is to try and to really bring the herbalists on board as the medical fraternity and discuss with them. So there's a lot of unknown about herbs. There is a lot of unknown effects of the herbs themselves. Could be to the liver, could be to the kidney. You get it? Yeah. So the current advice is that herbs might not be in the medical world unless we know what is in the herbs, unless we know which medicine is in the herbs, what concentration of that medicine is there, what are the effects. Because in the science world, every medicine you take, Zubedah, we know how much you should take. We know what are the side effects of the drug. We know what dose you should not take beyond. You get it? So there is a lot of information that is known in the science world. But in the herbal world, we don't know much. As your doctor, I don't want to put your life in danger by recommending what I don't know. So most times you'll find that most doctors may not recommend herbs. But we're coming from a point of not really knowing, because even the herbalists have not given us the information we want. Tell them, okay, so what is in that drug? They just know it is a tree, all the leaves and all that. But what is in the leaves? What is the dose? How can it affect your liver? How can it affect your brain and all that? We don't know that information. So the common knowledge is to try and discourage such things, okay? And just stick to what we know. Yeah. So whether it works or not, I can't comment. I can't comment on that. But of course, I know sometimes there are people who are taking advantage of patients who have fibroids.
Yes.
Okay. And that is unfair because you may end up spending more on the herbs than the surgery you should have had. I've had patients who go to places and they tell them to take out murubuto to burn the fibroids. Then after some time, they have taken over 5 million of your money, and then you still come to hospital, and we still have to do what we recommended you to do. So you find that you're wasting time and your resources, and then you still end up going through the same things.
Okay.
Yeah, but I know the fear is there. When you tell someone we need to remove the fibroid, operation. People really tend to fear so much
and
the
this
operation.
thing of doing the operation and then they come back.
But also, you see, like I said, the operation should be to relieve your symptoms.
Not
If
to
you
cure.
if you have fibroids and you don't feel anything, then there's no need for you to have any operation. You get it? Eh? Yeah, and you're okay, you're giving birth okay, your periods are okay, there's no need. When you reach menopause, those fibroids will stop growing and regress.
Okay.
You get it? So not every fibroid is a surgery. But when you're a doctor, and sometimes you have to also be careful. I know that some doctors will see one fibroid, small, fibroid. So you need to take time and just explain to the patient and tell them what it is. It's not a death sentence that, it's a surgery sentence into body fibroid to mulongo saneda. Okay, that those we just observe, and after that we monitor the patient.
Okay.
Yeah.
So, doctor, someone told me fibroids sitting a balloon. How do fibroids look like?
So
the
fibroids are really firm. They are solid structures, and I know this. Do you allow me to just show an image of the fibroids? You know, even from just this image, the way you see them look like this in this image, this is how an actual fibroid looks like. Let me see if I can just show you a picture of an actual fibroid. Okay. But they are really just simple. They look like rubber.
Rubber?
Yeah, they're. Just give me a minute, and maybe the producer can just.
So you can't pierce them.
They are firm. They are really firm, and okay. So here you go.
So doctor tunoonyeza fibroids. Alina fibroids kati doctor agambye nti omuntu alina fibroids bwe ziba toyina signs zonna, toyina bulumi bwonna, ozaala bulungi naye nga bakukeberako ng'olina fibroids, obleedinga bulungi bw'ogenda mu pizzo, tewali nsonga lwaki obeera weeraliikirira oba yadde okudduka ku operation. Bw'onootuuka mu menopause bijja kushrinkinga, bijja kulekeraawo okukula, obeere at peace. Wabula bw'oba olina signs oba obulumi obuyitiridde, awo oba olina okubeera nga ate ogenda mu ddwaliro. Bw'obeera nga toconceivinga naye nga bakukebera ng'olina fibroids, genda olabe dokita. Omukugu ku ebyo fertility mubeere nga takukebera kuba agambye nti omuntu alina fibroids asobolera ddala okuzaala unless otherwise.
So I just picked a picture. I don't know how clear it is to the viewers, but you can see.
Is it clear? You will put it in.
Yeah. We'll maybe show it in the picture. But you can see, these are the real actual fibroids. This is how they look like. And when you hold them, they're firm. Okay, they're solid. Okay, as you can see, they look like they are rubbery. Okay, those are, as you can see, a bit rubbery and all that, but they are usually just firm structures, and they can be as small as this, as you can see the small ones, and they can be as big as they can become. You get it? So they are.
So these small ones, they're the one who
which grow. Yes. So a fibroid normally it doesn't start big. It starts as a very small structure, but because you keep going, getting your periods, buli mwezi, so they keep on increasing.
They feed on blood.
They feed on the hormones. The hormones of the menstruation are the ones that make it to grow. But number two, as they grow, they also form new blood vessels. So as it's increasing in size, there are blood vessels forming around it to feed it and make it increase in size. So it keeps on increasing and increasing and increasing in size. Okay. So this, yes?
Doctor, can those fibroids be transmitted sexually?
Zubedah, unfortunately, faibroids are not sexually transmitted. So this time the men are off the
safe,
hook. They are not
because
really.
they can do sexual intercourse with someone with fibroids, and then he brings the fibroids
No. So the fibroids are purely in the genetics. They're not really. They cannot be transmitted sexually.
Okay. So Dr. ndowooza tatuyisiza bubi naye ngenda mubuuzayo ekibuuzo kyaffe nga kiri off topic but still because regarding the other interview I had that was circulating all over, so people are scared, people are saying hospitals amalwaliro gatubba, all that money. Now today I said I will ask Dr. Eladu our question. Doctor, we have a problem. Now, I did an interview with someone, but they told us something scary about pregnant women and us mothers. They told me, you doctors, when we give birth, you sell our placentas to rich men, rich people out there. They eat placentas. Okay. And we sell them over $50,000. So they told us to start demanding our placentas after birth. Okay. Are we supposed to demand the placentas or we are not supposed? Then can a placenta be eatable?
All right. So there are so many practices about placental care for over generations. You get it? And in our setting, there are people who have rituals they do on placentas. There are people who bury placentas. There are people who do so many things on the placentas. As families, you get it? Eh? Now, in developed countries, placentas are not ideally discarded. Okay? They use placentas for stem cell research. Okay? In developed countries. So the placenta is a very important structure because it contains cells that can help you in the event you get cancer and all that. Those cells can actually be used to sort of manage you during that time. That's how simple I can say it. So developed countries don't really discard placentas, you get it? Now, in our setting in Uganda,
yes,
most hospitals do not have capacity to do research on placentas, right? We don't have that capacity.
So where do you put them?
So like all medical wastes that we don't need,
you burn
we
them.
burn them, okay? We have, most hospitals have what we call incinerators.
Yes, I know.
Where we burn wastes, medical wastes. But companies that deal in medical waste, where they can take the medical waste and burn the medical waste, you get it? So most hospitals discard. And usually my discussion with the patients during the antenatal is, what do you want to do with your placenta? Okay? So I ask you.
I want to put them in the plants. They told me placentas with plants.
So you see, everyone is entitled to what they want to do.
So I can ask for my placenta?
You can ask for your placenta. In fact, I've had patients who have asked for placenta and said, doctor, they even come with their bucket and say, doctor, placenta, put it here. And we give it to them. So no hospital wants to hold your placenta because they don't do anything with it. You get it? Yes. So if you really want your placenta, talk to your doctor. Tell them, at the point of delivery, give me my placenta, and we'll give it to you. You get it? One time I had a patient, I asked her, what do you want to do with the placenta? And she said, doctor, I don't want the placenta. After I delivered her, when I was speaking to her mother, the mother said, Neda, doctor, njagala placenta. So we had to get a placenta and give it to the mother because she wanted the placenta. But of course, we sought consent from her. So talk to your doctors. Do not be afraid. If anything, you're saving the hospital the burden of discarding your placenta. So if you want it, well and good. But then, yeah, you will know what to do with it. For us as hospitals, that is waste.
You don't need the placenta as hospitals.
That is waste. That is waste that we don't.
Because they told me you don't burn them. You sell them.
No.
So I said I'll
at
ask
least,
Dr. Eladu.
to the best of my knowledge, at TMR Hospital and some of the hospitals around town that I know, that I actually work with, they do not really have use for these placentas. Okay. Now, are there dubious people out there who go behind and I can't tell. These are all hearsay and all that,
But people eat them.
I didn't know until you told me. But also, I've had people who...
So that they don't grow old.
Can you run away from age?
Dokita bangaye mubaziya mbusmani babeera bagumu mulaba musajja butakaddiwa
nga ali the placenta.
Agirya.
He feeds on one placenta every day. Yeah. So most hospitals, at least to the best of my knowledge, they discard the placenta.
So it is okay for you to ask for your placenta.
Please.
Lukusaro, it's your freedom. Buuza gamba mumpe placenta yange.
Yeah. If you really want it and you have a way and you know what you want to do with it, it's really. But I know there are people who have religious concerns and they're like
culture.
Yeah, and there are people who have cultural concerns. So it really depends on what you want to do with it.
So you temina chemukozesa placenta z'abantu temina chemuzaagaza.
To the best of my knowledge, hospitals discard those placentas.
That was the topic last week. Circulating all over. Oh, so these people are eating our placentas. Oh, doctors, why didn't you tell us about
your doctor
this?
should be able to give you back your placenta if you really want it. We should be able to give it to you.
Okay. So, doctor, thank you so much.
All right.
Bannayuganda mwebale nnyo mwebalire ddala. Placenta doctor agambye oli waddembe okugisaba. Ebyo byonna ebyogerwa tabimanyiiko tabirinaako idea. Naye nga bali mu rituals oba biki asuubira nti bayinza okuba nga basobola okuba nga bazikozesa. Naye waliwo naye yatugambye nti placenta mu kukuza ekimuli yereka etyo.
No comment. No comment.
Yeah, it's the health chart. Osobola okubeera ng'onyumyamu naffe, osobola okunoonya app ya TMR, n'onoonya Dr. Eladu, n'ojja ku TMR for fertility issues, omukyala alina obuzibu bwonna kuzaala.
Ne ku TikTok and YouTube.
Ne ku TikTok, Dr. yagenze ku TikTok. Yes. Dr. Eladu Emmanuel.
Yes.
So mugende munoonye doctor. Mumubuuze ebibuuzo byonna bye mwagala. Yazze ku TikTok. Finally, welcome to TikTok family. Yes. So doctor is on TikTok and YouTube.
Yes, YouTube as well. Yeah.
YouTube. Yeah, doctor, please concentrate more on
TikTok.
YouTube.
On YouTube, yes.
Yes.
Okay, YouTube.
So doctor is on TikTok. He is on YouTube. You can go there, ask him all what you want to know about your health. N'abasajja bajje?
Yes.
Yes. Abasajja n'abakyala mugendeyo. Doctor, twamwelkaminze kati. Ali online. Yes. So, katuberekereze tubadde naalya ku TMR Hospital. Tubeera wano buli week Doctor atwayo interview ku bulamu bwaffe. Yetumubuuza ebibuuzo ebyo bye twagala okumubuuza. So yes, I know you guys are impatient about the infections, but next week Dr. agenda tuwa ku infections. Abakyala balina recurring infections ezitawona. They are scared. Bayinza okuba balina cancer wanabaana. Abaami balina infections ezitawona. Balowooza is it gonorrhea or it is prostate cancer. So next week, Dr. tugenda kumubuuza ku infections ezo ezisusse ezitakoma, and why are we having all those infections ku generation eno, yet we didn't have all those infections before. So musiibe bulungi, mweraba.
Thank you.
Executive Media. Focus, innovate, succeed.